Dorica Dan is well known within the PWS community. Dorica has a 37-year-old daughter who has Prader Willi syndrome. Dorica is a psychologist who initiated the Romanian Prader Willi Association in 2003, the Romanian National Alliance for Rare Diseases in 2007, the Romanian Association for Rare Cancers in 2011, and the Neuro Centre, which is a centre for expertise for rare diseases, in 2011. Dorica has been a member of the board of EURORDIS, Rare Diseases Europe, since 2007 and was also a board member of IPWSO. Among her many other roles, Dorica is a member of the National Council for Rare Diseases in Romania. Since 2018, she's been an Ashoka Fellow, and she was also a member of the Romanian Social and Economic Council until 2020. So we invited Dorica here today to give us a European perspective on newborn screening. Thank you, Dorica.
Thank you very much for your invitation. I'm honored to be here with you today and to share about the landscape in newborn screening in Europe. IPWSO invited EURORDIS to speak to this meeting, and EURORDIS appointed me to speak. I would like to share just a few information about EURORDIS, which is the European Organization for Rare Diseases. It has 995 patient organizations as members in 74 countries. 28 of them are in Europe. EURORDIS has 44 national alliances for rare diseases, 72 European federations for specific rare diseases. It was founded 25 years ago, and we have more than 40 staff members in our offices in Paris, Brussels, and Barcelona, and we have more than 440 volunteers. Why is newborn screening a priority for EURORDIS? Because most of the diseases that are screened are rare diseases, of course, and because early intervention can prevent the aggravation of the disease and or delay the disease progression, improving the quality of life for the patient, but also for the entire family and society. And until now, there is no consensus among the members, state members in Europe regarding newborn screening, and the landscape in Europe is quite different. I'd like to say that I'm from Romania, and Romania for sure is not in the driving seat for newborn screening. We are screening only for diseases, and this is awful for Romania, and even those that we are screening, we are not doing quite well. So I think there is a need for improvement in Europe and more harmonization about newborn screening. There are countries which are screening almost 50 diseases, like Italy, which is the driving, which is the top on screening. And we are trying to follow the model of Italy and to find out which is the best model to share among the member states in Europe. So we created a newborn screening working group in EURORDIS, and the goal of this group is to review the current policies and practices in the field of newborn screening and to develop principles for harmonization of newborn screening programs across the member states of European Union. We have 24 members in this working group, and it is, of course, a multi-stakeholder working group. So until now, EURORDIS have created this working group in 2019 to map the newborn screening landscape in Europe and to assess the challenges and the potential solution and develop the main principles to follow in newborn screening. The consultation was with our members, with national alliances and European federations, and it took place on between June and September 2020. And we had also a round of consultation to review the principles that we develop in the working group. Then we have invited other stakeholders at the European Roundtable of Companies, including policymakers and also industry representatives. And we had a workshop to develop these principles and to assess our work from the point of view of ethical, social, and economic impact of the newborn screening. Also, we have published in 2021 a position paper with 11 key principles for newborn screening, and we launched a call to action for decision makers in order to support the changing and the harmonization of the landscape in Europe in the field of newborn screening. Now we are in the process of dissemination of the position paper and asking for policymakers to contribute and to support our work. So we have developed the key principles, 11 key principles for newborn screening. And I will insist on some of them, which I think are also sustaining or supporting the newborn screening for Prader Willi 2. So the first principle is that screening should identify opportunities to help the newborn and family as broadly as possible. That is, screening should identify actionable disease, including treatable diseases, because until now, the member states insisted that they are performing newborn screening only when the disease can be treated. But we still have more than 95% of the rare diseases which are not having a treatment until now, but many of them are so-called actionable diseases, and we can have therapies that can improve the quality of life for patient and family if they are early diagnosed. So we could avoid the diagnostic odyssey for these families. We can plan for newborn care and therapies, make informed decisions for future pregnancies, and support research. Then the second principle newborn screening should be organized as a system with clearly defined roles, responsibilities, accountability, and communication pathways. The third principle is that the family of the newborn who has been diagnosed through newborn screening should be provided with psychological, social, and economic support by the competent national health authorities. And I think this is also a principle that should be taken into consideration for newborn screening in Prader Willi syndrome. All stakeholders should be included in the different stages of the newborn screening process. And I would insist here on the involvement of patients and patient organizations, because they are the only one who can speak about their needs and their expectations and could share this with the others. Then the fifth principle is that we need clearly defined, transparent, independent, impartial, and evidence-based process. This sixth principle is about governance of the newborn screening that should be explicit, comprehensive, transparent, and accountable to national authorities. The seventh principle is around inclusion, exclusion of the disease in the newborn screening. And we have to base our decision on the best available evidence. The eighth principle is also a principle that should be taken into consideration for Prader Willi newborn screening. Information and education of all stakeholders on rare diseases and the whole newborn screening process is essential for a broad and fair implementation of newborn screening programs. The ninth principle is about the timing, to address this on timing, sample collection methods, and follow-up. And information shared with parents are needed to guarantee the uniformity and quality throughout the process. The 10th principle is about appropriate safeguards for data protection and data access, to be sure that we have all these processes in place. And the 11th principle is that European reference networks affiliated centers should be integrated in the care pathway of the different healthcare systems and should be considered as preferential partners to provide recommendations on newborn screening policies. And we show that EURORDIS' role in this process is that it's the only the patient organization could show the views of people living with rare disease and their families. And all these 11 key principles we hope that will be incorporated in the European policy that will uniformize the newborn screening in Europe. And hopefully all this work will support the patients to be early diagnosed and better integrated into the services that they need. As key messages, I would say that this is a very hard and long time collective effort from all the stakeholders involved. And it has to be done with the dialogue between patients, parents, policymakers, and treatment developers, together with clinicians and academic experts on newborn screening, on the technology, on ethical and economic aspects. There is a need for a whole collaboration among all the stakeholders, including national authorities, for timely decision making. And the impact of early diagnosis can be life-changing for patients and families. This is what we should focus on when we are advocating for newborn screening. And this is also our interest, I think, in IPWSO. So this is my presentation, and I'm here for your questions. Thank you very much.